Good morning, everyone. My name is Shriya Kunam, and I'm a student from Denmark High School. Today, I'm beyond excited to share with you how predictive AI is transforming global health, particularly in enhancing chemotherapy accessibility for women with estrogen receptor positive breast cancer. My research I'll be discussing today has the potential to contribute to a world where we can accurately predict who truly needs chemotherapy versus who can safely avoid its harsh side effects and high costs. With the power of AI, this is no longer just a dream, but an emerging reality. So before we dive into today's topic, let me share a little bit about myself and my background. I'm currently serving as the Vice President of Officer Relations for Georgia HOSA, where I've had the privilege of attending the International Leadership Conference 2 times. I'm also interning at local rehabilitation clinics, focusing on neuroscience and oncology. I'm conducting research at Emory University, specifically exploring ways to enhance chemotherapy accessibility for ER-positive breast cancer patients. Outside of academics and research, I am actively involved in community service through my local nonprofit organization called the DreamBridge Foundation. Some of my interests and future endeavors that drive my work and vision for the future include neuroscience and neurological rehabilitation, as well as oncology and treatment accessibility. These interests are more than just academic pursuits for me. They are the driving force behind my research and my future goals. So moving on from that, here's a little bit of background to understand the significance of my research. Let's take a closer look at the context of breast cancer. So breast cancer is not only the most common cancer worldwide, but it's also the leading cause of cancer death among women. It disproportionately affects individuals in low and middle income countries, according to the World Health Organization. Here is the harsh reality. Cancer is incredibly expensive. In 2017, 36% of patients reported being unable to continue working during and after treatment. Nearly half the women experienced financial difficulties due to the high cost of care. This burden is even more significant in low and middle income countries, where 23% of cases occur in compared to 10% in high income countries. When it comes to treatment options for ER-positive breast cancer, there are primarily two approaches. Hormone therapy, which targets hormone receptor positive cancers by reducing the body's estrogen levels, which these cancer cells need to grow. Now, chemotherapy, however, uses drugs to rapidly kill dividing cells throughout the entire body, regardless of hormone receptor status. But what if many women with early stage ER-positive breast cancer could safely forego chemotherapy without compromising their treatment outcomes? Imagine the impact this could have. This would mean a drastic reduction in treatment costs and significantly less strain on the patients undergoing treatment. My research aims to make this a reality by employing predictive AI models to assess the efficiency of chemotherapy in treating ER-positive breast cancer. So here are some of my research objectives. So, some key definitions. What is predictive AI? So this type of AI is designed to identify patterns and trends in large data sets, which is like my research, allowing for accurate forecasting and decision making. Now, ER-positive breast cancer, which stands for estrogen receptor positive breast cancer, is simply a type of cancer that grows in response to the hormone estrogen. And so the problem, put in simple terms, is that chemotherapy effectiveness varies widely among these patients. And many women experience the chemotherapy side effects and have to undergo treatment without any guaranteed benefits or changes in their treatment outcome. And some of the project materials that I used is the Jupyter notebooks, Python libraries, genomic analysis tools, and more. And the project dataset that I used is from CBio Portal for Cancer Genomics, and it's a public dataset with 2,509 primary breast tumor data. So my research methodology, let's uncover the steps behind my study. So step one was screening. So we started with a rigorous screening process to ensure that I included the most relevant cases. We focused on women diagnosed with adenocarcinoma of the breast, specifically those with ER or PR positive breast cancer. These cases had to meet additional criteria like negative axillary nodes, tumor sizes ranging from 1.1 to 5.0, and a HER2 negative status. And step two was mutation count. We zeroed in on the genetic mutations that could significantly impact the recurrence risk prognostic score, a scale from 0 to 30 that we created that indicated the likelihood of cancer recurrence. We identified key proteins and genes such as BRCA1, BRCA2, and more. The more mutations that were present, the higher the risk score. Step 3 was categorization and treatment allocation. With the data and the risk scores in hand, we categorized our patients within the data set into 3 risk groups. Low risk, which was 0 to 10 score, and these women were assigned hormone therapy alone. And intermediate risk, 10 to 20. For these women, we randomly assigned them to either hormone therapy alone or hormone therapy plus chemotherapy. And then high risk was 20 to 30, and women in this category received both hormone therapy and chemotherapy, given their elevated risk profile. So, our results. Our AI model analyzed 600 women and revealed that for 70% of those within the intermediate risk group, adding chemotherapy did not provide a significant benefit over hormone therapy alone. This finding suggests that many women could avoid the harsh side effects and costs associated with chemotherapy without compromising their treatment outcomes. So this is our statistical analysis for our AI model and a result representation to show how the risk recurrence score increased with the age of the patient. So the key conclusions that we reached in simple terms was that chemotherapy might be avoided in 70% of cases, which would spare countless women from undergoing unnecessary side effects and financial strain. So what does this mean from a global health perspective? Imagine a world where many women can avoid the grueling side effects and substantial costs of chemotherapy. This would not only improve their quality of life post-cancer, but also significantly reduce their healthcare expenses. And number 2 would be personalized treatment approaches. This means that each patient can maximize the benefits and minimize any unnecessary interventions. With the immense power of AI at our disposal, we face a crucial question. Can we afford to ignore the opportunity to prevent millions of women globally from undergoing unnecessary treatments? The pace of AI will inevitably drive change. It's an amazing technology, but it's up to us to ensure that these changes are beneficial. So let's embrace AI's potential to craft personalized, compassionate care for women everywhere. And here are my references that I used throughout my presentation and research. And I would love to acknowledge my high school science department, my friends and family, the National Breast Cancer Association, and you guys. Thank you so much for listening to my presentation and tuning into my research. And please contact me with any questions or anything at all at my email or my LinkedIn. Thank you so much.